All right, good afternoon, everybody. Thanks again for coming back for our 2:15 to 3:15 session. We are pleased to have Joel Hoepfner. We're talking about action-oriented coalition meetings in just a second. I'm just going to read his brief bio, then we'll turn it over to him. Joel received his Bachelors of Science in Psychology, as well as a teaching certificate from Central Michigan University in 2009 and 2003. He has worked in the behavioral health field for over 16 years and is a certified prevention consultant. He's held that credential since 2008 from the Michigan Certification Board for Addiction Professionals. He became a mental health first aid training youth and adult instructor in February 2016. He is the previous chair and current member of the State of Michigan Training Advisory Council, as well as the current chair of the State of Michigan Epidemiological Outcomes Workgroup that operate through the Michigan Department of Health and Human Services. Joel has a long history of providing leadership, direction, and individualized technical assistance along with state, community, and agency-wide trainings, workshops, and webinars on a multitude of topics for diverse audiences. I also happen to know that he is an avid fisherman. We both share that in common, so we're both looking forward to salmon season this year. But without further ado, Joel, take it away. Thank you.
Excellent. Thank you, Mike, so much. Appreciate your work on this. Was happy to be a part of the planning committee too. You guys did an excellent job putting this together. Really nice offering for folks. I'm going to go ahead and share my screen and get the slideshow up. I also want to thank everyone for their time and energy today. I really would love to see your faces. And because I know a few of you, and really appreciate the time. Just allowing me to be here, allowing me to share this information. Really humbled to just share this this presentation with you all. It's kind of a teaser. It's kind of a test for what I've been working on with the state of Michigan. As many of you may know, I've been training the prevention prepared communities for some time. That training is a full dayer. Some of you may have been through that. It's a 101. It goes really through up to a 501. But the prevention prepared communities training, there's another one next Monday and the 31st. It is full, but hope to have those offered again next year, along with a PPC 201. And that is going to be around coalition effective coalition building, and more information will be shared. But this piece, this action-oriented coalitions, is one small section of that day, of that training day that I've submitted to the state and have received approval for promoting that and sharing that for the next fiscal year starting in October. So I really appreciate just the opportunity to share this. I love feedback, so I'd love to hear people in the chat about how this information resonates with you, how this information can help you as a coordinator, as a staff, as a supporter of local coalitions. And really my intent is to empower the behavioral health workforce and our community members to be more empowered, to be more effective in collaborative efforts. So this action-oriented coalition meeting PowerPoint is really tied to that piece, and I'll jump right in. So again, this starts with some of the things that you all faced, that I've faced over the many years of being involved with several boards, several county coalitions, statewide coalitions, regional coalitions, advisory councils, committees, work groups, task force, and so on. These challenges really are seen by everyone. I don't think anyone is immune to this. Even the most formal boards and coalitions of the U.S. and the nation deal with these things. But some of the challenges coalitions face, our staff does all the work. Members serve as advisors or supporters. That is a tough frustration for staff. And that is truly an advisory council, not necessarily a coalition, work group, committee, or task force, where those members serve as more of advisors and supporters of your work and aren't involved in the work so much. Inconsistent meeting attendance, that happens to everyone. That is something that's really hard to deal with, hard to address. There's not a perfect solution. Lots of meeting with little achieved. We are a meeting field. We do sit and support a lot of different meetings, either internally, externally, or other. And that is where we try to get a lot of work done, or as much work done as we can in a collaborative environment. Little, if any, formal decisions being made at or within meetings. Excuse me. So this is talking about really, you have meetings, but what's being done? What's being acted on? What are the formal decisions being made? Is there a vote that happens at every meeting? Are you asking for your coalition members to be a part of decisions? Or is it more of a report out or a sharing? So I just want you to consider some of these things as we talk throughout this hour, and think about questions that you may want to ask later on, or if we have time, we'll definitely interact with the chat if you have specific comments or questions. Coalitions move slowly or does not move from assessment and planning into action. So the strategic prevention framework or planning framework talks about, moving from the assessment, building capacity, to writing strategic plans and implementing those plans and evaluating those plans. A lot of groups struggle with assessment, or actually they don't struggle with assessment, they do well in assessment and planning, but they may have struggle with into action, or they may have the other way around where they do well with initiatives and activities, but don't have a formal plan for their coalition, or a formal needs assessment that has been done around substance use disorder prevention or behavioral health issues in general. Coalitions cannot demonstrate outcomes. So this is something I was a part of, just monitoring over time. The ability for effective coalitions to produce outcomes was obvious. And those coalitions that struggled were having struggles with demonstrating outcomes. And what I mean by outcomes, really, products and deliverables, things that you show your funder, media marketing, social media marketing campaigns, large initiatives, programming, program evaluation, program outcome evaluation, things like that. And then little or no communication between meetings. I think this is something that's underutilized. I'm a part of, again, many groups, and what I really appreciate is when there is a meeting, we get things, we take action within those meetings, and then after there is additional communication, not blowing up my email, but one or two, or maybe more throughout the full month, that's 30 days or more between meetings, that there is opportunities to share communication around all kinds of different things that are happening in the substance use disorder prevention arena or other arena, suicide prevention, whatever it may be. So I think little or no communication between meetings is something to consider going forward. And if anybody has those resonate with you, please throw those in the chat, and Mike or I will catch those as we can, and have a chat about them. So Mike, feel free to interrupt if I can't get to them or I don't see those the chat box.
Will do.
Thank you. So some things that coalition meetings should not be, hate to use the negatives there, but may adjust that in the future. But for me, I really have limited time. I want to be a part of all kinds of things, meaningful things that are going on in my community. But I don't have the time for strictly community report out sessions, staff report out sessions, or all about members advising staff on the action that staff should take. So as a member of a committee, I have an interest to be there for the most part. Sometimes people are forced to be there or asked to be there or voluntold to be there. But the idea is to not just report out on your activities, but have the coalition take ownership in those activities. And we'll get to some of that with the agenda development. The other piece is all about members advising staff on the action the staff should take. That's a tough one too. That happens quite a bit, where I as members of your coalition, they may feel like that's their role, that they come to the meeting, they come to your coalition meeting as a service to you, as a support of you and your agency, and advise you on what to do around whatever it may be, whatever topic you're covering. So that's something to consider, something to potentially adjust. And we'll talk about staff or committee roles and membership roles as we go. Staff-led sessions where the staff does the majority of the speaking. That's not a red flag, but I would say an identifier of we need to activate membership, identify role clarity, and empower them to be a part of the coalition and be a part of the dialogue and the topics discussed. And then lastly, they shouldn't be time spent with limited dialogue between members without any member accountability. Accountability is a tricky one, but they are participating, they are there. If they're present, they want to be involved, they want to be a part of something meaningful, and your work is very meaningful. And however you can interact and engage them in this work is the most beneficial work that you'll be doing. And I know a lot of groups out there do an amazing job. A lot of people on the call do amazing work, amazing partnerships with their community networks. And I'm just trying to support that and add to that flavor, because the groups that are very effective can be excellent and exceptional trainers, models, role models for others as well. So let me see here, just wanted to check the chat real quick. Voluntold, love that. It's all about engaging others in the work we do. I totally agree. And that's not easy, but it's the trick. And I think prevention has done an amazing job with this over time. That has been our role and function. So let me just, waiting for my slide to advance. There we go. I'll make sure I'm on the right one. There we go. Steps to facilitating effective and more meaningful meetings. For me, these steps are really important. I think for coordinators, people weren't trained. Staff were not trained in how to facilitate meetings, how to be a coalition coordinator. You hired for the job, you applied for the job, or you got identified for a position, and or that role and function was given to you or added to your workload. So for me, facilitating effective, more meaningful meetings is something we all need to learn. And even the best board chair can learn how to facilitate more effective meetings over time. And again, there's some amazing people that facilitate amazing meetings, but I think we can all learn from each other on how we can be more meaningful, more effective in our work. So first for me is establish an action-oriented meeting agenda. So when you set your agenda, you set the bar high and you identify what is the action of this meeting. And there's a double check to that that I'll talk about. If you can't identify an action or a formal decision to be made from your coalition membership, then that's the question, should you have a meeting? Secondly, engage the membership. Engage the membership in any way you can. Ask for them to report out different things they've been involved in, different activities they've been involved in, or initiatives they supported. Determine what and when items should go to committees or work groups. This is important, so it doesn't have to all happen at the coalition meeting, but you definitely have subgroups and subcommittees and work groups to kind of share the workload. And those are important. A lot of folks have those already in place, and those are very beneficial. Define the role of staff and membership. So that's, I think, something that just needs to be communicated. If you're struggling with advisory councils or people that just support what you do and want you to continue to do the work, then maybe a time to step back and reiterate the roles of staff and membership, because I'll talk about specifically what the role of staff is. Oh, I got I got a new kitten and a cat, and they're going to fight a little bit. So that may be some good sound effects for everybody. So defining the role of staff and membership is excellent. That's a big deal. And people, new folks may not know their role and responsibility as a member of your coalition or a participant of your coalition. But I think having those dialogues with those folks or with the group is important. And then identify intended outcomes of the meeting. So what are the decisions made, next steps identified in each meeting that you have? So again, action-oriented, engaging, what and when items should go to committees, define role of staff and membership, and what are the identified outcomes of the meeting. I'm going to read Mike's because I'm not sure if he'd read his own, but I also think as a field, we have not done a good job of really training and bringing younger prevention specialists along. I think a good portion of people fall into the profession and hit the ground running. I agree, Randy, other folks definitely. I think I was trial by fire. I was applied for a position, took over the position, was basically the facilitator of a coalition committee within seconds. And, you know, I was fresh out of college and that was my role. And these were interacting with the judge, the local judge, the law enforcement sheriff, if not under sheriff. And I was off and running, and then superintendents, everybody else, that was the level I was walking into. And a lot of folks are doing the same. So again, these steps are important. I think we want to think about those with every meeting that we have. Any meeting that you're involved in should be action-oriented. You're engaging the membership. You're deferring things that need to be deferred to a different committee. You're defining roles or redefining roles, and you have intended outcomes of the meeting. It's a little slow on advancing slide. I apologize there. There we go. Establish an action-oriented agenda. So this is my just providing an example for folks. What I see is agenda items that are committee or agency updates introduced by the chair and discussed by paid staff. So I'm reading all the what it is currently or what I've seen a lot of folks utilize. So things are introduced by the chair and discussed by the paid staff. They're stagnant or cut and pasted month to month. Members advise staff on action to be taken. The same 5 or 6 people attend each meeting, and that's not a bad thing, but we can talk more about that. New members attend only 1 or 2 meetings and never come back. That's somewhat of a flag. But what we want to do is take those agenda items or what we have been doing or considering, or if we have some of these things, to agenda items that are related to the priorities and outcomes of the coalition. The list person who will be leading, time and action to be taken. Progress is evident by new and emerging items on the agenda. Action planning and delegation happen. Members and partners are recruited to meeting based on agenda. You don't have to have everybody there every time. I can differentiate the meeting participants based on the agenda. We all have groups that have 50 on the email list, but 15 show up. They can fluctuate. It's no problem. I know people have bylaws and things like that require 60% participation in yearly meetings or monthly meetings per year. So those things are important, but you can recruit based on agenda for those specific months of meetings. And then new members are quickly engaged and continue to participate. So new members are key. They should continually be added to your coalition or group, because it may take some time to find the right people for your committee or coalition or work group. So again, from these types of updates, staff doing the work, stagnant agenda items, people advising you on what to do, to having priorities and outcomes of the coalition identified in the meeting agendas, identify other people that will take on that item. action planning and delegation that recruited to meeting based on agenda. Setting the agenda for action. So these are important things, and I'll give you an example of one of what types of agenda are really action oriented. So we're making sure that agenda items reflect the current work of the coalition. We want to make it, we're drawing it from the plan, really. That's what I do. I draw all my agendas from my strategic plan or action plan for my agency, my department, my coalition, and so on. So I draw the agenda from the plan, action statements, goal statements, objectives, and strategies. That is how I build almost every agenda that I work on and that I facilitate. I set an agenda that requires members to be active participants. So if I don't have anything on there that they need to participate in or provide feedback in, I question if I need a meeting. I can basically send that out as an email, as an update, and we can save people's time and respect their time and maybe meet the month after. And we do this at the State Epi Outcomes Workgroup, the data workgroup for the state of Michigan. We make sure we respect folks' time and energy to be there. And if we don't have active agenda items or action-oriented agenda items, we need to consider taking a pause and just submitting or sending things out via an update via email. Include action items that require decisions to be made. Again, asterisk like a board level agenda would be, your asterisk, you're identifying action items on the agenda. We're not overscheduling folks or meetings, and we're not holding unnecessary meetings. That's an important one for me. I think that everybody here respects that. Take the break, you need it. July is a good time. People often take that month off. December, January is another time frame that are sometimes a break, but don't force things that are not necessary. Here's what I've learned through research is an ineffective or passive meeting agenda. And people can throw in the chat, or if you're a part of coalitions or other networks that use this format, this is what research has bore out is a passive or ineffective meeting agenda. You're seeing welcome and introductions. You're seeing committee reports.
Yeah. But
sorry, was there a comment? Somebody said, I think supported this. Committee reports, new business, then old business, director's report, next meeting, and adjourn. It's very assembly line like, and there's not a lot of room for adjustment or creativity or action oriented items to be included in here. And it kind of falls on the membership to formulate the real agenda, because under new business, if anybody has any new business, nope. Okay, we move on. Old business, well, we've dealt with those things. We're saying it again, and we've just taken time on old business that's already been addressed. So what they're saying is this is just more of a passive meeting agenda framework or format than what we want to see in our coalitions, which is more of an action-oriented meeting agenda. So again, if you see any of these components and agendas, maybe, and what we'll do in the PPC 201 is you'll look at your agenda as coalitions, and you'll formulate new agendas based on the format that I'm proposing, and with some nuances, obviously, with some folks have their already, they can share other examples of effective and action-oriented meeting agendas, and I love that. But I just want to make sure people see that the passive, it is identified as a passive meeting agenda if they're set up like that. So here's focused agenda items. What we want to do, we're taking things right from the strategic plan. I think it's really important. I think some comment, isn't this just a format for an agenda? And under each item, you would put the items that are new business and old business. You would only put if you had previous meeting items that need to be addressed. It is a format, but what it does is it, in a sense or in itself, slows the process or the progress of of what an action-oriented meeting agenda could be, because for most coordinators and a lot of staff, they put those items, but then do they flush it out with specific items as new business or specific items as old business? Or do you rely on the membership to flush those things out, or remember that we need to talk about this as new business and these things are as identified as old business? So I appreciate the comment, Ashley. It's good stuff. The format is definitely the problem, but it's also the facilitation or the expansion of it. So I see a lot of agendas that are strictly that. There's no other detail but that setup, and they've done it for years. And so I'm just saying that there's opportunities to adjust that agenda format and really pull from your strategic plan, your action plan, and include, welcome introduction, item 2, reduced number of retail selling to minors, successes, challenges, next steps, action to be taken by who, when, and it's the access to alcohol committee chair that's doing that. I mean, a lot of you guys do have this stuff, which is great, but I want to make sure that you're thinking about everything you're putting in that agenda as meaningful, as relevant, as opportunities for engagement and taking action with your items. It says, respond to marijuana dispensary proposal and city ordinance initiative, and then opioid prevention plan presentation, identify next steps and action items. So you're always moving items forward, and you're identifying action steps that will be either followed up via email or taken on for the next month's meeting. I think is something that's very important. So what is the role of staff? I think for me, it was, again, thrown at me at the beginning, and I, just kind of trial by fire, figuring out how to move a group. I can write a strategic plan pretty quickly, but having a group write a strategic plan is a whole nother ball of wax. It's a whole nother collaborative, team event. It is so time intensive, and it slows the process down so much, but it's so meaningful. So for me, the role of staff is to assist and support the group in accomplishing a common task, to move through the agenda in time available, make necessary decisions and plans for implementation or action. So you're always thinking implementation or action and decision-making. And then staff members empower coalition members to make more informed decisions and should promote the idea that each person has a role to play. So that's important. The role definition, defining those roles for members is, I think, something crucial that's sometimes forgotten. I'd ask how many of the folks, that are involved in coalitions have a orientation meeting or a training for new members. That's really positive, but it's time intensive. It does take some effort, and I've seen some groups have a whole orientation PowerPoint. They share it, they offer questions, they answer questions, and they're ready to go. And those are time intensive, but it's something to consider. Staff members do not make decisions for the group, but suggest ways to help the group move forward. A lot of staff, it's all on your shoulders, and that's very tricky to think about. So I want you to realize that that's not on your shoulders. It's really you're facilitating and empowering the group to make decisions as a group. You are part of that decision-making process. You are influencing and informing that decision-making process, but it's not all on your shoulders. And it is not the role of staff to know everything or have all the answers. And I think that's something that as coordinators and as coalition staff that we feel like we have to have all the answers. Defer it, you'll research it, you'll get back to them. There may be things obviously that you're not able to answer. Don't feel like you have to have the answer to everything. Tips for coalition staff. I think these are kind of cool. They're helpful for just to reiterate what you can be and what I think the intent is. Remember, you're the savant of the group, the facilitator or the steward. You're of a process. You want to plan ahead and work outside the meeting. Communicate with members of agenda items to discuss or take action. Clear purpose for the meeting. Don't hold a meeting unless you can state the true purpose of it. And I think that's important. If you can't identify the clear purpose for a meeting, maybe either reassess the agenda or hold off on the meeting itself. And be clear about who should attend the meeting and how they can benefit from, as well as contribute to the meeting's goals. I have more on that piece in a second about why do people go to coalition meetings? What do they want to get out of it? And I think that's important for us as facilitators and as coalition staff to consider. And then follow up on previous meeting next steps and action items. And then optional, some people use these, some people don't. Delegate meeting rules, the minutes, timekeeper, scribe, greeter, those types of things. Effective coalitions provide the following. So this one I really like. I was set in on a planning process with ISAP, the Ingham Substance and Awareness Coalition, Substance Awareness and Prevention Coalition in Ingham County, and we worked through basically asking the question to the members, what would you like out of this group and what can benefit us all? And I have adjusted these a little bit, little liberties, but this is what I really appreciated as a coordinator, to know that I can provide each meeting, or a majority of these things I can try to provide each meeting. I always try to provide resource sharing. So I'm bringing resources, publications, things that I can share with the group that they may not be aware of. And, you know, we're a conduit, we're a catalyst for sharing resources, and that's always encouraged by all members. You could have a whole resource table where people just bring in every month stuff to share. So as you on your way out, you can always grab those things. Upcoming trainings, training and workforce development is important in our arena. Always promote trainings. Provider network updates, so service delivery updates, what type of programming is going on, what are your treatment agencies doing, things like that. Common vision, goals, and direction are important. It should be somewhat on the agenda or available to folks. Opportunities to network is always a part of it. That's kind of a general one. New laws, legislation, policy, and advocacy. This is something I always like to promote. Is I think all coalitions should have a platform to some degree. I know you guys do a nice job with McCrud and are involved in advocacy and policy activities, but I think there's a lot of room for growth in that advocacy realm, and all coalitions, you know, having and considering a platform for advocacy, not lobbying, advocacy. That's just educating your community about policies and practices that you want to see considered for change or considered for adjustment. Trends in the field. There's a lot of things going on. I mean, the last 10 years, geez, we've had so much more added to our plates with trauma informed, with integrated care, with co-occurring disorders, with suicide prevention initiatives, with you know, all kinds of things that just we, you know, couldn't imagine before. We were just substance disorder prevention field, and we didn't have to think about recovery and or treatment and how they all blend together and how they all support one another. Integrated care, trauma informed, all that stuff. So it's the trends in the field are important. Partnership opportunities are key. Funding streams are key, and new ones especially. Job openings, clarity, consistency, and focus. So you're always moving in this, for the most part, the same direction. People know what that group's about or what your group's about. And as we've been talking, action oriented, and you have measurable outcomes. And I have a template for annual outcome evaluation report or an annual report that coalitions can utilize if people are interested. But I think measurable outcomes, you're sharing your outcomes, you're promoting yourselves as an asset, as a resource in the community, and people know if they have questions around substance use disorder issues, they come to you, and they come to your coalition, or they connect with you in some way, shape, or form. So this is where we get into the sustainability checklist. We have okay time. I'm not going to go through this a ton, but because I want to get to questions and just general feedback and comments. But I did, in the training, the full day training, we'll be working through this sustainability checklist for your coalition. And what you'll do is identify recommendations and next steps within each section. And what we want to see is 3 priorities identified going forward, and any additional considerations for discussion. So this is the what's going to be one of the workshops within the full day 201, PPC 201 that I'm hoping to offer next year. But this, what I'll give you is a little taste of it, and I can walk through the document, and it's been sent out to you folks so you can kind of walk through it as you like. What I would love to do and what we would do in the training is have people grouped within their county coalitions, and they'd work on this together in the small breakout rooms in Zoom. So that's kind of what we're planning. But for this venue, we're just sharing the document, giving you the tool, and you can utilize it as you wish. If you're in last year of DFC, if you're in Drug-Free Communities Grant, if you're looking for other ways to sustain your coalition over time, I think it's a nice checklist that supports your work and can give you some ideas on what to prioritize and work on moving forward. So what this is, again, sustainability plan and checklist, what it looks at, some of the categories, strong membership and involved partners. And I can bring this up actually with my, really quickly. Just gonna switch to this one. And what I'll do is just have it on the screen so you can see some more of it. Strong membership and involved partners. Are you guys all seeing that still?
Yes.
Okay, it says it's paused, but your screen sharing is paused. As long as you can see it, we're good. Strong membership and involved partners. That's a major category. Transparent and considerate community planning process. That's very important. Then we go to connected to current community problems and areas of concern and readiness to make change. So you can be talking about problems, you can be talking about areas of concern, but if you don't have the readiness in your communities to create change, then you need to get to work around more PSAs, newsletters, Facebook presence, website, email blasts, press releases, things like that. I mean, there's so many concerns and issues and problems right now, especially in the in the pandemic, that we want to have our coalitions be formative media messaging machines. And you guys, I think a lot of folks do an excellent job of getting information out about initiatives and events. But do you put out PSAs? Do you put out email blasts in between meetings? Do you have a website or Facebook presence that's solid, that has, thousands of followers or hundreds of followers or whatever it may be? Because this stuff is very topical right now and very relevant. And we're seeing our Facebook page at CMH, gather. We've been increasing 40-fold every month, 40 followers, if not more, and we're barely able to get to it in all the work that we do in my department. So social media and marketing and communication plans are really important right now to get the messages around substance use disorders, about mental health and well-being, about suicide prevention, about all the things that we're talking about, opiate issues, vaping issues, whatever it may be. So it goes through that. Then data-driven and outcome-focused is the last section. We want to identify what 3 items identified above need to be prioritized for action and additional considerations for discussion. This is an excellent executive committee template. It could be used with the full coalition. And again, what a complete sustainability plan should include: items to address, state the issue, key resources needed, existing resources that you own or have available to you, sources and strategies, action plan to implement, who's responsible, and time frame for action. So this gives you kind of a checklist or a readout on where your coalition stands around. Do you have around role clarity? The third one down, coalition members and volunteer groups are provided clear roles and expectations of their involvement within an MOU or other partnership agreement. So there's role clarity, role delineation. Yes, no, unsure. Recognition and rewards are provided to coalition members, volunteer groups, community leaders, businesses, community residents, and other partners. Certificates, awards, annual celebrations, things like that. Yes, no, or unsure. Planning. The coalition develops and follows annual or biannual action plans to implement its strategies, ideally derived from the strategic planning framework or prevention framework. Yes, no, unsure. Where is another one from the community problem area is the coalition community is informed about behavioral health problem areas and issues via PSAs, as I said, newsletters, press releases, Facebook, etc. The community is aware of what the coalition and its partners are involved in. So are you promoting yourselves well? Promotion of behavioral health services, trainings, events, and opportunities. There's a study that was done, Alterum. They did a nice study that showed that 25% of the folks on Medicaid and that were in need of services had no idea where to go for services. No idea, zero idea of where to go for services. 25% of, that's, you know, a lot of people on Medicaid, hundreds of thousands of folks, and a good portion of them, 25%, did not know where to go. And that means we're not, and again, we don't get the funding to do advertising, but you know, we can creatively promote our services, our supports, our trainings, our events, and opportunities. So again, we don't advertise our services, but as preventionists and as coalition members and service providers, we definitely need to promote and creatively promote our activities throughout the community, because the majority of folks aren't aware of what we are offering and what's available to them. So we have a little bit more time. Any questions, comments on this, or things to discuss? And then I think we're pretty close to just offering any time for questions and answers.
Joel, we had a comment from Kathy Geiger. Her comment says, July meetings have been canceled and there's no active work at the time. So it seems a month is lost when assignments to members could just be made at the June meeting. So what's your thoughts on June meeting assignments and then July meetings being canceled? How do you best handle not losing that whole month?
Well, I definitely either, if we can, if there's any work groups that can move things forward or at least provide an update, but you're totally right. There has been a break in activity, a break in work, a transition time for everything going remote and for the work to begin again. So for me, it's, I don't know if you can make up that time necessarily, because I've been on several boards and committees, even the state of Michigan, we did pause. What we didn't do is let that stop us. I think what we did is our first agenda back, we took note of the pause, we took note of the pandemic and the other issues that are affecting our communities. And we said, this is vital to our work. We need to continue to support this work and we need to get things moving again. And what we did is in any agenda that I was a part of, make sure it's action oriented. It brings those things that we were working on that weren't completed or that were in queue, and bring them forward, make sure they've been addressed, and then also with new additions, new considerations, because it's a totally different environment. So I totally respect that comment. That's great. I've lived through it. You guys have lived through it. For me, it's even more vital to our work to make sure we're effective, meaningful, and promoting ourselves as action-oriented community coalitions and groups that are assets and formal assets to communities and their populations and their residents. So I would say don't let that month go. Make sure you revisit what was the previous minute stated, the agenda, and build from that. But then you also have to totally adjust, I bet, to the new environment. Does that make sense? Hopefully, if anyone feels free to comment on that, does that answer the question? I don't think you can do it any other way. You don't want to lose it or let it go. You have to kind of jump head on addressing what's occurred. The pause happened. We don't want to lose our momentum, and we need to take action as soon as possible on those previous items, and then these items that are now a part of our reality, which is remote work, a slower pace to some degree on some things, a different way to approach our community. Outreach is different, programming is different, if at all, for prevention. I know I wanted to hear some of what our regional entity is talking about as far as what is prevention doing in the epidemic as far as programming. So I'm not, that's not my world anymore, but I am connected to a lot of prevention providers that do programming, but I haven't been able to chat specifically about what are they doing, how are they adjusting, are they providing those virtual. I know what we're doing is we're switching everything to virtual. Our mental health first aid trainings, our QPR, which is question, persuade, refer training, we're virtual, and we're looking for other things that are resiliency based and supporting community wellness in a virtual environment, because I don't know when we'll get back to in face-to-face large group, 30 to 75 people in a room indoors. Is there any other questions or comments that came up from the chat?
Just one about the sustainability plan and checklist. Just so everybody knows, you do not have to do it right now. We're not going to quiz you on it or anything. That's just a tool that Joel has provided that you can take back and use with your community coalitions to help your planning and sustainability processes. So thanks, Joel.
Yeah, there's no quiz, there's no test. This is just for information. It was also embedded in the PowerPoint, so you have that reference with the PowerPoint slides that were shared by Mike or will be. Really, in summary, and we can go, offer time for questions. Action-oriented coalition should consider making action the core element of your agenda. So anything you bring people together, if it's your subcommittee, your full coalition, your data committee, or other task force or association, you're trying to make action the core element. Transforming ideas into tasks, that's a kicker, that's a tough one. We have a lot of people with ideas in the prevention field, but are they able to be moved forward as tasks? We bring forward a lot of different things in our coalitions. There's a lot of opinions, a lot of ideas. The best coalitions turn those ideas into tasks or into action oriented tasks. And beginning with a purpose. So this is a big deal for me. It's beginning with the end in mind is also another way to say that. Begin every coalition meeting or every activity that you're involved in, or a group meeting. It could be a task force, committee, subcommittee, with a purpose. Why are you meeting? Why are you bringing these people together, and have an intended outcome of those? I want to get to the chat seems to come and then go. It kind of slips away.
We have another question from Kathy Geiger. She asks, are focus groups and using existing data such as MiFi all that's needed to develop a strategic plan?
Can you say that again? Because funny thing, I'm not seeing all of those questions on the chat. You're getting either it's individually or if it's, can you say that one again?
Sure. Kathy asks, are focus groups and using existing data such as MiFi all that is needed to develop a strategic plan?
Yes, you can utilize any existing data that gives you relevant information and somewhat representative information for your communities to move forward. Now, what you don't want to do is make statements about how that is representative of your entire county, your region, or other. If it's a focus group of this population, you can represent it as such. My thing around data is how people represent it after the fact, or when they share it in a community report or in a data and action sheet. I want to make sure they represent it accurately and appropriately. This is a focus group. Questions were taken and answers were taken from this group of a population or a subgroup, and these are the things they said. So that's more qualitative data. And then when you talk about, there's their statements and their feedback. The quantitative stuff is MiFi, the large groups of data pulled from your schools. That's gold. That is great stuff. But still needs to be, you still need to be careful on how you make statements around its representation. It represents those who took the test within your county and out of all of the districts in your county, and it represents a self-reporting mechanism of those students. So it's not perfect, but it's very solid. It's very good to drive decision-making. And my whole thing is data-driven decision-making, but I would always say, don't wait for all the data. And I can assist with that. I support different coalitions on writing plans and strategic plans and data and action reports. That's been something I've been involved in quite a bit. The data and action report, or the needs assessment toolkit, there's one on the state data repository, the mi-suddr.com. If you're not familiar with that, that's through MDHHS, Michigan Department of Health and Human Services. And that central data repository is an excellent resource for folks, and it gives you some templates in the help section or example section that I was involved in with MSU outreach and engagement. So lots of good tools out there, a lot of coalitions. There's several groups probably on the call that have great data and action templates, and hopefully people can share those. And if not, connect with me and I can get you some great examples of data and action templates that drive decision-making, and you don't have to have all the data. The best is county level or program specific data. But again, don't let not having all the data slow you down. There it is. Thank you, Mike. mi-suddr.com. That's what the SEOW that I'm a part of has worked on for many years. And it's a great tool. It gives you the data for any grant or any logic model or any proposal that you have to submit for a funder or a potential funder. And in my trainings, all I'm trying to do is support groups being data-driven and grant writing machines. I mean, that's the key for prevention, is if we can access all the different funding streams that are available to us, we will be so much more powerful, so much more impact in our programs, services, and collaborative efforts. And I see Barry get that data and action template. I can share that for sure. There's a few great examples. I know a few different coalitions that use it. I know there's many more. We only have a few more minutes. Let me finish this up, and then any other chats or questions we have time for. So beginning with a purpose, I said, and summarizing action steps at the end of every meeting. That's what we want to do in action-oriented coalitions. Again, action is the core element. Transform ideas into tasks. Begin with a purpose, and summarize those action steps at the end of every meeting. Sometimes you can have a great meeting, but if you didn't put it into the minutes, or if it wasn't reiterated at the end, everybody forgot. There's so much on people's minds. These are volunteers at other organizations. Those takeaways, those next steps, those action items, reiterate those at the end of the meeting. And I think people really appreciate that, because that's our role as a facilitator, not theirs as a participant or a volunteer. So lastly, I do have free technical assistance available to coalitions. I just want to offer this. I've been doing it for the last year or two, beyond the training that I provide, but it's in partnership with MDHHS and OROS, the Office of Recovery Oriented Systems of Care, and CMHAM, Community Mental Health Association of Michigan. I really appreciate the partnership. This has allowed me to basically go and give free technical assistance. It used to be in person, but now it can be. But it's, webinars, Zoom, calls, emails, texts, whatever it may be, on action-oriented coalitions, evaluations, sustainability planning, strategic planning, logic models, which can be scary but shouldn't be, grant writing, and other things like characteristics of highly effective coalitions. So I just want to make that note, and you're welcome to connect with me in any way, shape, or form, and I'm available to you on the state of Michigan, which is excellent. I'm really happy to be able to do that. And I really appreciate the time and people's comments and the chat, and just the ability to be able to share this stuff. More to come for the PPC 201, and I want to open it up for any questions or final thoughts before we got about 5 minutes. Anything else that's on your mind, we can dialogue. a concern, a question about your coalition, or anything else that you would like to have shared. Anything else?
I'll read a comment from Randy. It says, we try to get at least 2 data points, hopefully more, to confirm one another. For example, where are youth getting using alcohol? We surveyed students, parents, law enforcement, and used MyFi. I should say that this method can also disprove our notions or show that we need to dig deeper to find facts. That sounds like a good idea to me. Great, thanks. Shelley said she plans to use it, take it to the coalition, her coalition.
Love it. No, I really like that data statement, because if I mean, that'd be a whole nother training there. For me, you know, data tells the story. And for me, the more you can tell the story, the more likely everyone will not doubt it. So it sells itself is what happens. When you get really good data and you get deeper into the data and you have the multiple levels of data for your populations that you're looking at, that's such a richer story than if you just have 1 or 2 indicators. So I would agree with that wholeheartedly. There's so much I could talk about data, but I really appreciate that comment, because for me, it tells the story, and the more that you can bring in that information and collect that information and compile that information, the better story your coalition will have around your community's needs and problem areas. So great stuff. Thank you so much. I appreciate everybody, and continue to do the great work that you do. If you guys have any other questions, we still have about a minute or 2.
Yeah, one more question, maybe. A lot of good positive comments in there, but one maybe last question. Any ideas on recruiting members?
For me, you know, I'd be happy to talk with anybody on this. I can take calls and things like that. Again, free to anyone. For me, it's find the allies in your community. It may not be the ones you think about. It may not be those systems or those health and human service agencies that you're already working with. It may be someone totally different. But for me, I want every coalition that's working on this issue, the substance disorder prevention issue, suicide prevention issue, behavioral health issue, connect with hospitals as much as you can. Different folks within different hospitals is amazing. Universities have amazing resources for you. Connect with those folks. They need you. They need to connect with you more than you realize. Hospitals have so much money in this world, and they're working. They need you guys, and actually will be utilizing, and some already do, utilize your coalitions to support their efforts and their mandates as a hospital authority. You know, churches, amazing network. There's so many. So for me, it's about looking at your community, understanding your community, and then identifying the specific agencies, community groups, or allies that will make your coalition even stronger.
Well, thank you very much, Joel. I appreciate the presentation. I think everybody else did too. Certainly reach out to Joel if you have additional questions. I'm going to go ahead and stop recording. And